In the small town of Canby, Oregon, Tom Jaquez enjoys an afternoon Scrabble match with friends. A simple pleasure for a man who led a full life as a newspaper reporter, father, and husband. Tom, like thousands of Americans, lives in an assisted living home. While he misses his own house, he cherishes his time. He enjoys his surroundings, freedom of movement, and the ability to still live his life. Without assisted living, life might not be so smooth for Tom.
Would be. I'd probably be in somebody's back bedroom and as a grandpa, pestering the family and the kids and irritating them, but I'm not. I'm independent. That's what this is all about, as I understand it, and that's what it feels like to me.
Today, Tom and thousands of others enjoy the security and home-like feel of assisted living. But this environment didn't always exist, and wouldn't at all if it weren't for several forward-thinking individuals who, in the 1980s, saw a need in their communities for a new style of long-term care for older adults. Tom lives at Ratcliffe Place, which was the dream child of Dr. Karen Brown Wilson and her husband, Dr. Michael DeShane, both gerontologists. Now, more than 2 decades later, Karen has returned.
This is a very special place for me because it was my first small building in the state of Oregon to be licensed as assisted living. I felt like we had to have an answer for smaller communities and to have a place where people who did not have the resources to pay on their own and needed some kind of assistance from the state government through the Medicaid program could live in the same kind of environment that we knew other people wanted to live in. So this was an experiment that many people thought could not work because it was too small, because it was for low and moderate income, because it was in a smaller community, because it was not fancy. But for me, it'll always be my firstborn, the model of assisted living that I think represents what assisted living can and should be for older adults who are looking for that type of place to live.
Karen's quest to build Ratcliffe Place came out of love for her mother and a desire to see a change in the way seniors could live in America.
She wanted a more normal life. And for her, a normal life meant a different environment, one that was more like a home. For her, a more normal life was a place where she was in charge, that she had control. And for her, a more normal life was not being treated as if she were sick, because she was frail and she had a lot of problems and she needed a lot of help. But in her mind, she was not sick.
It was a dilemma being faced by families all over the country. The federal government had subsidized the building of nursing homes during the 1960s and set up Medicaid to enable people of low to moderate means to be cared for in them. While nursing homes were much needed for people with serious physical impairment, people who just needed a little extra help but could basically care for themselves had nowhere to turn. Unknown to Karen and her co-workers, Paul Clausen and his wife Terry were facing the same circumstances in Virginia, leading to their building of a new type of long-term care facility. It was the origin of Sunrise Senior Living, now one of the largest assisted living providers in the country.
There were, at the time, 20,000 nursing homes with almost 2 million beds that had been built since 1965 to, let's say, 1985. And a tremendous explosion, but the tragic result was length of stays in a facility that was designed maybe for a short length of stay at best, built on a medical, sterile, institutional model, was seeing length of stays of 2, 3, 4 years.
These pioneers of the industry met with great opposition to the idea of assisted living. Janet Sehan was on the Rules Writing Committee for the state of Oregon when Karen Brown Wilson came knocking with her bold new plan.
I didn't like the idea at first. I had a lot of reservations about it. I had been involved real heavily into the adult foster care and also with the residential care. So I felt we had enough programs and that we didn't need this other one, and I thought it was kind of a pie-in-the-sky idea. So I entered it reluctantly, and then as the time went on, I became more and more convinced it was the answer to providing a different type of care.
Assisted living is not something between independent living and a nursing home. I just, when I hear that sometimes, I get agitated, because assisted living, for those of us who pioneered it, this is a new long-term care model. It's an alternative long-term care model based on a different environment and different operating philosophy.
Great strides have been made in the long-term care industry in the past 30 years. Sadly, the funding of care for the elderly in the United States is a mishmash of regulation among the states, and slim on reasonable, concise plans for the future on the part of the federal government.
What most of us realize is that our system for paying for long-term care, our financial system, is fundamentally broken. It's, if you need long-term care, and whether you have the resources or not, if you have the resources, you will quickly become, they will quickly be gone. Whether your own income or your savings or your assets will quickly be spent. And that's whether you're living at home or in assisted living or in a nursing home. How we pay for long-term care is something that we have not as a society been able to address.
This film, Assisted Living America, will profile the long-term care industry from its origins to its present position. Looking beyond the industry today, Assisted Living America seeks to educate the public and promote healthy debate on the future of long-term care in America.
As human beings, we want a say over how and where and when we receive care. And we want to have a say over how we live out those last years, and most importantly, how we live out the last weeks and months of life. It's tragic that most Americans say they want to die at home, and yet most die in hospitals and nursing homes, looking up at 48-inch fluorescent tubes with, with tubes in their arms. That's not what Americans want. Slowly but surely, it's beginning to change.